We're going to begin. All right, well, good afternoon, everybody. I'm Peter Zanoni, Corpus Christi City Manager. And today, which is Friday, we have customarily been just having Dr. Bird from Texas A&M Corpus Christi present statistics and modeling for the Coastal Bend region in terms of COVID-19 cases and recoveries and that type of thing. And we're going to do that as well today, but I'm going to give just a quick update on the numbers. We reported on Wednesday, and I'm just going to, I have data from Thursday, so Wednesday, Thursdays will show now. We're still tabulating today's data. So I'll do that first, and then Annette's here, our public health director, and we want her to say a few words to the community on how we can stay safe. We still have to remind ourselves on the importance of some of the, I think it's 5 or 6 key things about keeping your hands clean, keeping your hands off your face, wearing a mask when you're in public, setting where it's a confined space in particular. And if you feel sick, stay home, those types of things. So Annette will remind us about those. Our public health official, Dr. Ramachandruni, who works for the City County Health District, is here as well, and he spends most of his time in the hospitals helping patients with COVID-19 and other ailments. He's an expert, and the city retains him for these types of emergencies. And so we want him to come up also after Annette to just give us his perspective on the situation, as well as what he sees in the hospital. That's primarily where he lives his life, is in the hospital setting. And then following him, our main person, Dr. Bird, will be here to present an update on his modeling and show us what he's projecting, both in terms of cases being caught, as well as some of the issues at the hospital. And then we do have a pre-recording. Judge Canales, as many of you know, is at isolation at home. She has tested negative for COVID-19, but because, come on up, but because she and her fellow commissioners were exposed to an employee at the county during a county commissioners meeting who tested positive for COVID-19. She's finishing out a 7-day stay-at-home confinement situation. But anyway, so she won't be here, but we do have a recording that she recorded today, and we'll show that at the end of the briefing. Okay, so what we want to do is let's remind ourselves about the numbers. Yesterday we had a significant number of new cases, right? Here's yesterday. So there were 65 new positive cases. Today we'll have the data. We usually have it ready around 4:35, right? But as of noon today, we had 40 confirmed for Friday alone, right? 40, so it's going to be higher by the time we get to that 4:30 time frame. But you can see the 65 followed a pretty heavy week. That's Thursday, and the 29 new cases, 31 on Tuesday. I'm sorry, the 29 was Wednesday. The 31 cases was Tuesday, 24 on Monday of this week. So this is our worst week. We've had some pretty high weeks, especially when we had the outbreak at our meat processing plant, as well as at some of our senior facilities. But this was our worst week in our tracking of this. So you can see, though, it followed a pretty bad week the week before. We had 15, and then 11, 7, and 3 on Tuesday, and then 11 on Monday, the 8th of June. So Dr. Bird is going to put this in greater context in terms of prior history and going forward. But the key message is things are not looking good, especially this week, and especially yesterday with 65 new confirmed cases. We want to show you hospitalized patients because that's going up as well. And so on this graph here, when we were reporting this in May and April and prior and even early June, the cases would always kind of be in the 6 number of persons in the hospital. Today or yesterday, we were up to 19 persons hospitalized with COVID-19. And they'll get that slide up in a second here. But this week it was, here it is, we had on Monday there were 13 on Tuesday, 18, and yesterday 19 in the hospital. And Dr. Ramachandruni will elaborate a little bit about that, but you can see the trend rising. Traditionally, our numbers, like I said, in that 6, 4, maybe 7, but we're a little bit concerned with this 19 number in the hospital. And on this next chart, you can see of those 19, 5 are in intensive care. And one other thing that's new to report from yesterday is that we've had our 6th death now in Nueces County. You can notice that 6 over here. So the message on that is we were concerned that we had 3 deaths. That was back in April. And it had been pretty steady in terms of new deaths. So there had been 0 new deaths since April 23rd up until this week. And so from April 23rd all through May, all through now, through this week, we still were maintaining those 3 deaths in Nueces County. But on Monday, we reported a death. On Thursday, there was an additional death. And then between last night and this morning, we reported earlier today a 6th death in Nueces County. So a total of 6 deaths for the county. You can see on the donut, we have 260 active cases. And then we have 219 recovered persons. So we're more than 50% active. Our total number of cases, just so you know, is 485. That's the total confirmed in the county over time. But as you can see, we do have recovered, so about 219 recovered. And then 260 persons are still active. And then you can see the 6 deaths on there as well. And let's just show you some trending. Dr. Bird's going to have a lot more, but we trend over time since we've been counting this, the number of cases. So you can see it was pretty flat down here. We had some, single-digit numbers. You can see what's happening now towards this latter part of the week, that big spike of 65 yesterday. That gives us a 7-day running average of just under 24, 23.5 approximately, cases per day over the past 7 days that you can see there. That's what this red line shows us. And then we're still doing a lot of testing. In fact, we had a testing site this morning. I think we're doing one tomorrow, in fact, because we had too many people today to get them all done. And then Annette will talk to us about additional testing sites. But you can see a little bit there of testing. And the next chart is going up slightly. It'll continue to go up. Here we go. It looks a little bit flat down there at the end, but our 7-day average is 139 tests performed per day. That's a 7-day running average. We've tested a lot more over time. This big hump there was when we had our meat processing plant testing site, and where the state came in and helped us with some of the Army reserves to do targeted testing. So it just goes to show we're still doing tests. If you can see the last blue line over there, there's a big spike on here. Right, so we've increased testing given the community-wide outbreak that's taken place. Okay, so that's a quick rundown of the numbers. We will have an update for today around 5 o'clock. And then we're going to report just for the community and the media, we'll report through the weekend number of new cases, because we're going to do testing tomorrow through a drive-through testing site. And then maybe a testing site on Sunday. Annette, is there on Sunday? Okay, so just Saturday there'll be testing, and then on Monday, Tuesday of next week, and a few other days. But our practice had been to report on the weekends the number of new cases and that type of statistical information. It's on the city-county joint webpage for coronavirus. And but over the past couple of weekends, commercial labs and hospitals stopped giving us information because they were kind of ramping down. And that may change now given this big community-wide spike that's taking place. So we'll report this weekend if people want to see the number of new cases from Saturday, Sunday. That'll be on our website. And we'll also do our email release to the community. And I think that concludes it for my part of the presentation. We're going to, at this point, translate some of this into Spanish. Gabby's going to do that. And then we'll have Annette come up and give us some health information. And followed by her will be Dr. Ramachandruni, and then we'll have Dr. Bird with his more extensive presentation.
Quiero dar un resumen y actualización en cuanto a las cifras por los más recientes casos positivos. El día de ayer tuvimos una cifra significativa de 65 casos. Hasta este mediodía el número de casos positivos es de 40, pero más tarde daremos la cifra total. Esta ha sido la peor semana con el mayor número de casos positivos después del brote en la planta procesadora de carne. El número de las hospitalizaciones también va en aumento. El día de ayer teníamos 19 personas en el hospital. De esos 19, 5 personas están en la unidad de cuidados intensivos y hoy reportamos la sexta muerte vinculada al COVID-19. Aún tenemos 260 casos activos y 219 recuperaciones. La tendencia en el condado va en aumento, a pesar de haber tenido varios días de cifras bajas. Continuamos haciendo pruebas hoy y el día de mañana. Nuestro promedio de pruebas diarias es de 139, pero debido al aumento de positivos, también van a aumentar las pruebas. Este fin de semana sí vamos a publicar los resultados de las pruebas debido a las últimas cifras. La publicación se va a realizar en nuestro portal de internet a la dirección www.cctexas.com/coronavirus.
Good afternoon, Annette Rodriguez, Health Director. Nueces County has experienced an increase in positive cases over the past few days. Along with the increase in cases, we have also had an increase in deaths in Nueces County. It is very important now, more than ever, that you follow prevention tools to reduce the spread of this virus. The Health District received confirmation of the sixth death of a Nueces County resident due to COVID-19. The deceased is a male between the ages of 60 and 69 and was hospitalized in late May. His comorbidities include coronary artery disease. Our deepest sympathy to his family and to his friends. To keep up with the spike in cases, the Health District has been conducting a series of drive-thrus to try to detect anyone that is positive in the community that might be spreading the virus. Being tested does not keep you from getting the virus, but it allows public health to contact trace every index person so that we can slow down the spread. At yesterday's drive-thru, 156 samples were collected. Of those collected, 53 were positive. The day before, 41 specimens were collected, 17 were positive. At this morning's drive-thru, there were 76 samples collected. These tests are still being analyzed. There is another drive-thru scheduled for tomorrow at 8 in the morning at Memorial Hospital parking lot. You can call 826-7200 if you are symptomatic and need to be screened. I want to reiterate, the virus is real. It poses a huge risk to our community. The current rate this virus is spreading in our community is too high and will cause our hospitals to quickly be inundated, and no one wants that to happen. Please continue to be vigilant. Social distance, wear a mask when in public, stay home as much as possible, wash your hands often, and protect yourself and your families. These basic and simple precautions can make all the difference in our numbers. Please practice good public health strategies so that the virus can be controlled until we have a vaccine or antiviral medications to help mitigate the spread of this virus. Stay social distance from others and do your part to fight the virus. Thank you.
El condado de Nueces ha experimentado un importante aumento de casos positivos. Le reportamos la muerte del sexto caso por el virus, un hombre de entre 60 y 69 años, quien contaba con problemas subyacentes de salud. El día de hoy llevamos a cabo 76 pruebas, aunque aún no tenemos todos los resultados. El contagio actual continúa aumentando. Le recordamos tomar todas sus precauciones de salud y así poder controlar la dispersión del virus hasta poder contar con una vacuna.
Hi, good afternoon. I'm Dr. Ramachandruni. I'm an infectious disease specialist here locally. I'm practicing in all 4 hospitals. So I want to kind of give you an update. It's been almost a month. We talked about the treatment. And first of all, I want to reassure you that we have a treatment that is very effective for COVID-19 for majority of our patients. The situation is much different than 3 months ago. Now we have treatment options. We understand the disease. We understand the disease mechanism.
And we're much better prepared in terms of hospital readiness, and so situation is kind of much better sort of after 3 months. Having said that, as you all know, in our hospitals, we're seeing increasing number of patients that are being admitted with this COVID-19. As per our local hospital administrators, we have plans to handle the surge effectively, and and I'm sure everybody has questions about the treatment, how effective it is. I made a video on cctvtexas.com. You can see it from June 9th. Sort of gives you an overview of treatment. And recently, about 3-4 days ago, as you must have seen in the media, there was a randomized controlled trial on the steroids being very effective in reducing the mortality rate, which is the death rate, according to this Oxford University in UK. But guess what? We've been using these steroids for the last 2.5 months, to be exact, from April 3rd. And also we've been using convalescent COVID-19 plasma much earlier than anyone from April 6th. Of course, remdesivir also joined the treatment options a couple of weeks ago, so we're able to offer all 3 effective treatments to the patients, and that seems to be working pretty good in majority of our patients. But the caveat is it works better when the patient comes early on. So what is early on? So there are 2 types of COVID-19. I would categorize it as disease presentations. One is they don't require oxygen. That means they're asymptomatic. They get fevers, chills, cough, and headaches, body aches, loss of taste, loss of smell, other classic COVID-19, but they can get over it. But as soon as they get, the other presentation is the one that requires oxygen. That means as soon as they require oxygen support, that means that we call as happily hypoxic. That means they feel they're okay, they can breathe okay, but if you check their pulse ox, the oxygen levels will be low. So that's called happily hypoxic. So if you walk short distances, like a few feet, you get short of breath. So that's the time you should probably go to either hospital ER, have a chest X-ray done, and to see how your pulse ox is doing. And that's when if we start treatment early on with all these 3 options, we can make them better. We can go much quicker. Most of our patients got better within 7 to 10 days when they presented early on. So the other important issue is I want to bring out is we thank all the COVID plasma donors, but we need more people to donate plasma, now more than ever. We have more cases coming in. We need, this plasma seems to be very effective in sick patients. I think one donor actually can do 800 ml of donation, plasma donation. So we only need 400 ml for each patient. So it helps 2 patients, one donor. So all recovered patients, I urge them to go to Coastal Bend Blood Donation Center and do your part. And so as I said, 1 patient's plasma can save 2 lives. The other thing is, I'm sure everybody's tired of hearing this message about wearing masks. But we healthcare workers at the hospitals, we may wear masks around these COVID-19 patients for the last 3 months, and it worked for us. So there's something that we don't understand. The masks seem to protect us, and I'm sure it'll protect everyone. If they go to a restaurant, please do wear a mask. In the sense, if you go outside, if you meet a friend, even though you trust him, he doesn't have it, but you should wear a mask. So the take-home message I would like to say today is we have an effective treatment that is working in majority of our patients, the 3 treatment options I just told you, and we have more remdesivir available, thanks to city and county officials. I think we had 4 batches of remdesivir, which is an excellent addition to our treatment options. And as I said, please donate plasma. And the last thing I want to say, definitely wear masks. Thank you so much.
Quiero darles información actualizada en cuanto al procedimiento para tratar esta enfermedad. Ahora entendemos mejor el virus comparado a hace 3 meses. Contamos con un mayor número de personas hospitalizadas. Sé que hay preguntas sobre el tratamiento. Tenemos un video disponible en el canal de YouTube de la ciudad que lo explica mejor. Hay varios tratamientos que se han usado en otros países, 3 de estos en especial, los cuales han dado buenos resultados en la mayoría de los pacientes, siempre y cuando la persona es tratada de manera temprana. Una vez que una persona requiere de asistencia artificial para respirar, es cuando debe de acudir al hospital y así comenzar el tratamiento lo más temprano posible. Ahora más que nunca solicitamos donadores de plasma para continuar el tratamiento. Un donante puede ayudar a 2 personas afectadas. Usted puede acudir al banco de sangre si se ha recuperado del virus. El uso de cubrebocas está demostrado que ayuda a aminorar la propagación del virus.
Right, good afternoon, everybody. My name is Dr. Chris Bird. I'm here on behalf of the TAMU-CC COVID-19 Modeling Task Force. We've been doing this for so many times I have lost count at this point, but this is a big one today. The purpose of the task force is to address public concerns and questions about COVID-19 and the interventions that are being taken place to try to decrease the transmission rate, and also to help enable our leaders make evidence-based decisions so that we're just not using our guts, we're also using our minds to be able to address the COVID-19 pandemic. Because we're in the middle of an outbreak, I think that it's important to review what an outbreak is, because we've seen different types of outbreaks. An outbreak, it's a rapid rise in the occurrence of disease, either in a localized area or a broader area. Technically, there's an outbreak of COVID-19 around the whole globe. That's why we call it a pandemic. But right now, there's an outbreak of COVID-19 in the coastal bend as well as in Texas overall. And this is different than in the middle of May when we had a localized outbreak in a couple different facilities here in the coastal bend area. This is a widespread outbreak that we're going through now, and so the dynamics are going to be a little bit different than what we saw in the past. I want to remind everybody that COVID-19 is transmitted through the air. It's transmitted through surfaces and touching them, and then touching your face, and it can be directly transmitted through contact. And our goal here is to reduce the transmission rate of this happening. The graphic that I have here shows you how rapidly COVID-19 can spread. Each one of these levels in the animation, let's see, well, I can't get it to go now, was 2 additional people getting infected for every 1 person that's contagious. And after several weeks, you can see that turns into a lot of people getting infected. So there's interventions in place that are designed to reduce the transmission rate. Stay at home if you can. This is something that people are still doing. If you can't stay at home, then social distance and wear face coverings if you can. If you end up, even though you did that, end up getting symptoms, and a symptom would be maybe you have a sore throat or a headache. You don't have to have everything together. Just one symptom is enough for you to self-isolate and call your medical professional, call your doctor, and get advice. You can call the hotline for COVID also. And get directions on what to do. You'll probably get directed to get tested for COVID. There's school closures that are in place. This has been going on since March. And lastly, what's not happening so much are the restrictions on public gatherings, and we've been slowly loosening those restrictions through time, increasing the openness of bars, which are at 50% occupancy right now, and restaurants, which are at 75% occupancy, and people are starting to have parties and things like that again. And if anybody's driven to the beach on the weekend, you can see any number of parties going on, which I define as more than 2 cars together, sharing the same area. So I think it's important to also review the philosophy of Open Texas and what's happened thus far. So back in March, COVID was hot. And I'm using a burner analogy. You can see we knew it was hot. We saw it in other places. And so we were concerned, and we turned the burner off. We implemented stay at home. We implemented a number of restrictions because there was a lot that we didn't know about COVID, even though around the world a lot of people had already seen it. It took a while for us to figure out treatments like what Dr. Ram was talking about. And the burner got cool. But the thing is we need the burner to be on for people to be able to, have jobs and make money and be able to move forward in life. And so the philosophy here is, well, we're going to take that dial and slowly turn it up little by little and see how much can we turn it up before it gets too hot. I don't know if any of you have an electric stove at home, but if you do, or if you ever used one, what you realize is it takes a while between when you turn the burner up and when it actually gets hot. So there's an offset there, and that's kind of the way that this works. So we've slowly rolled back interventions since May 1st. The idea is that if there is a flare-up, it'll probably be localized and we'll be able to contain it. And if it's a big flare-up, then National Guard can be missioned to go to a particular area of Texas and help with that. One example of this type of flare-up we had here in the Coastal Bend area. In May, we had the outbreaks at the transitional housing facilities and at the meatpacking plant. More recently, there's been restaurant dining rooms that have been getting closed down. That's an example of containing flare-ups. The contact tracing and testing, the census testing at the businesses where an outbreak is occurring, that's designed to contain. You contact trace to see how far out did COVID spread from that outbreak, localized outbreak area, and you contain it through the contact tracing testing and have people isolate that were exposed. Where we're at now is past that. The problem is that there aren't just localized outbreaks anymore. It's a statewide outbreak is occurring. We can't point to a zip code or a building that you should stay away from. It's everywhere. Basically, if there's more people, the more you should stay away from it. And lastly, if we get to the point where it gets too hot, then we're going to stop turning up the dial, presumably, and maybe even turn it back down a little bit if it gets too hot. So that's the way that I would liken the Open Texas philosophy that we're in right now. And it seems that we're heating up. So we can use cell phones to track people's behavior and assess how hot is it going to get. So you turn the dial up, it's almost like this is seeing how high is the dial turned up when we look at the cell phone data, because the cell phone data predicts when people might get into a situation where they would contract COVID. Then it takes a few days, about 5 days if you get infected before you show symptoms on average. Then it might take a few more days before you get tested and a few more days before you get a result. So you're looking at maybe a 10 to 14 day offset between when you get infected and when you show up as a statistic. Cell phones can let us see ahead and kind of look, what kind of behaviors are happening between foot traffic at different locations, amount of people leaving home, and potential encounters with cell phones coming close together. How risky is our behavior? And there's always a question about privacy. If you've used Google Maps and you clicked yes, you want your app, Google Maps or Facebook, or even the flashlight app. If you notice when we used to all have flashlight apps, it would ask to use your GPS. Well, that's how that thing made money. It was tracking where you went, and then that information sold and used to target you for sales. This is a circumstance where we're using that information for good, and we're not trying to sell you anything. We're just trying to inform everybody about what's happening. And also rest assured, nobody's name is attached to this data. It's very highly processed by the time that we get it. So here's an example of cell phone data that we can get. There's two different cell phone metrics we're looking at. The blue line is the people leaving home. We have it scaled to normal, where 100 is normal. It means 100% of normal. The way we define normal is how were we behaving, what proportion of people were leaving home before the pandemic started. And that's our baseline for normal that we set as 100. And then we deviate from normal. We got down to about 80% lower than normal people leaving home. And then we're back up to 94% or so from normal of people leaving home. The other one that's here is the red, is distance traveled. Obviously, if you have a GPS attached to your phone, which most of us do, it can measure how far you go. And we're back up to 100% of normal on average in Nueces County in terms of distance traveled. So it's up. We're behaving like we were before the pandemic started in terms of distance traveled. On average, there's still some people leaving home, but we're pretty close back to normal. So many are leaving home and many are traveling. The vertical lines on here, they're milestones. The first line is kind of pre-COVID, post-COVID, which we define as March 9th, which 2 days later, the NBA canceled their games, and everybody really realized right around then that COVID was for real in the United States. The green vertical lines are the interventions, major interventions that occurred here, the stay-at-home, and then the relaxation of that with Open Texas. And then the other two gray lines are major holidays which marked a change in our behavior. Easter, from Easter forward, our behavior started to increase, as you can see on there. Leaving home, distance traveled started to increase since about Easter, as well as Memorial Day. We saw a spike in some of the other cell phone metrics. And what we're seeing today seems to have originated around Memorial Day. Now, Memorial Day didn't cause this, but what we're seeing now started around then. This is a second second cell phone metric that measures potential encounters between two devices and presumably two people. The way that it works is if two cell phones come close enough together, there's then a probabilistic equation that runs to determine what's the probability that they'll come within 6 feet of each other or less and potentially transfer COVID. And we have this broken out in Fridays and Saturdays in blue and Mondays through Thursdays in black. I left off Sundays because sometimes they behave like it's like Monday through Thursday, and sometimes it's like Friday and Saturday, and it's just a lot cleaner to omit Sunday because the Sunday before Memorial Day there was a huge amount of activity, but on most Sundays there's less activity than normal. So the key thing is that on the weekends, especially Friday and Saturday, not so much Sunday, we're back at that normal level of amount of encounters that we're having. Now, if we put ourselves in a bubble, then those encounters won't lead to transmission of COVID. Wearing masks, social distancing. A cell phone is not precise enough to be able to determine if you're actually within 6 feet of another person. It does not know if you have a mask on, I don't think, although technology is advancing pretty rapidly. And so that's where this gets you to where the behavior is risky, but if you're doing something to offset that you might be close to other people, it could mean that this is not necessarily going to guarantee that you're going to get COVID. But the important thing is that there's a huge amount of activity that's happening on the weekends, like the pandemic never occurred. Last one I'm going to show you from the cell phones is the comparison of essential locations, which we have in blue, and non-essential. If it's not blue, it's not essential. And so we have home improvement stores are getting a lot of traffic, grocery stores getting a lot of traffic. We see those as essential places. Restaurants have eclipsed grocery stores now in terms of progression back to normal. They're really close to each other. You could say that they're about the same level right now, but they're really close to normal. So the same amount of restaurant activity, foot traffic now that we saw before March 9th. Mall traffic is up. You can see it's up in there too, about the same amount as there was before COVID. Bar traffic was rising more rapidly last week. It's kind of started to level off a little bit for this week. And the one thing that it seems that we're able to avoid is the movie theater for the most part. I think everybody's watching Netflix or some other streaming services at home. But again, these non-essential services, the activity is almost like the pandemic didn't occur for going out to eat and going to the mall and things like that. Now, if you take the appropriate precautions and put yourself in a bubble, again, maybe that's not going to lead to transmission of COVID, but look at what's happening around us. This is leading to the transmission of COVID. So sometimes the burner's hotter than it looks, right? Sometimes after you have it on and you turn it off, it stays hot for a while, even though it looks cool. So we turned it off. It actually looked like it got cool in April. And then when we started opening up Texas, that's us turning it back on, turning up the dial, and it starts heating up. And it took us till maybe last week or the week before that we really started to notice, okay, things are heating up, and we've been tracking it closely. And now I think we know that the burner's hot. I think that we can see that with these numbers, unprecedented for Nueces County and the Coastal Bend in general. So with that, we'll get into the case data report. This is a heat map of the amount of total cases that there's been in the 12-county Coastal Bend area, with Nueces County with the 420 having the most. If you don't like numbers, just sit back and zone out and look at the colors. The brighter red it is, the more cases there are. San Patricio County is second. B County up there with 32. There was an outbreak at a correctional facility there that accounts for a good portion of those. The Nueces update, I defer to Manager Zanoni's numbers, but as of yesterday evening, we had 65 additional cases added to the 420 that were already in place. That puts us at 261 active cases, and the recoveries is at 219, with the fatalities now at 6, I believe, if I've got the numbers right. I'm hearing a lot of additional new reports on this. I think there was one extra one this morning that wasn't reported yesterday, if I've got that correct. So overall in the Coastal Bend area, we've had 587 cases total. What I want you to pay attention to in this top blue line is how steep it is. The steepness, when it goes way up, that's when we have an outbreak. You can see here, it went way up. We had localized outbreaks. What caused these numbers to go way up was that every single person in the meatpacking plant and every single person at the transitional housing facilities were tested. There was well over 800 people that were tested that maybe normally wouldn't have gotten tested. So the numbers really went up with that census surveying. And now, if you focus where we're at now, you can see that the trend is increasing in the steepness, and really the last 4 days that we have represented on here, which doesn't include the new report of 65 from yesterday, it's really going up. That's the steepest increase over a 4-day period that we've seen for the whole period of time. If you look at the other blue line, that's the number of active cases that are estimated. You can see it's gone up and down and up and down. And it's just why you'll hear me say that we're on our third wave, because we're on our third wave. We went up, we went down, wave 1, up, down, wave 2. This is the third wave. It's bigger than the other waves that we've encountered thus far. And again, the fatalities were remaining fairly low, but overall, and our fatality rate was very low at about 1%. About a week ago, which was much lower than the average in Texas, which is 2%, or across the United States, which is 5%. And so this could be a little bit of regression to the mean as opposed to maybe a reason for a lot of alarm. But we'll see. If we look at the number of new cases per day, and the last one was cumulative total number of cases. This one is the number of new cases per day. Each point on here is a count of number of new cases that were reported, like what you read in the newspaper. The circles represent Nueces County in orange, and the triangles represent the rest of the Coastal Bend. And what you can see here is it's not just Nueces County what is going up right now in the number of new cases per day. It's the rest of the Coastal Bend also. And notice, I mean, there's a triangle way up here, the rest of the Coastal Bend up here with Nueces County. So if you live in a rural area, it doesn't mean that there's not COVID right now. I think that's an important take-home message. Now let's dig into this a little bit further. There's been some discussion this past week about how old you are and what's driving this right now. And so what this is, it's the same type of data as here, but we're going to focus in on the orange line, and we're going to pull it apart by age class. And so now what we're looking at is 20-year age bins and how many cases per day per capita. Per capita, we know how many people in the different age classes there are, and we're accounting for that. So that it's a fair comparison, because there's way fewer people 80 plus than there are people, say, 20 to 39. And what you can see here is that while, yes, people 20 to 39 are increasing in the number of cases, even when you account for how many there are, everybody's increasing. Not just people that are 20 to 39, people that are 40 to 59, people that are 50 to 79, people that are over 80, and people that are 0 to 19. So that's, everybody is increasing right now. There's no one age group that is being spared from getting COVID. And this is something I think is very well known, but I want to make sure that it's very clear that all people in the Nueces County area, and probably across Texas, although I haven't looked at the breakdown, regardless of your age, the number of new cases per day is increasing. We're going to look at the other part of the coastal bend, right? So we're going to take this green line and we're going to pull it apart. Just like we took the Nueces line, pulled it apart into age classes, we're going to take the rest of the coastal bend and break it apart into the counties. And we're going to talk about counties that I haven't talked about before this week. San Patricio, we have talked about. It's kind of graduated at this point to a more Nueces level amount of new cases per day. And probably next week, if that continues, I won't be able to show it on this graph anymore. Otherwise, you won't be able to see the other counties. But we've got Jim Wells with an increase, Kleberg with an increase, Aransas, which is hiding underneath some of the other lines right there, with an increase, Refugio, and B County. Again, you heard me talk about earlier about that correctional facility outbreak. That's what's causing that, that hump there that occurred. So it's not just Nueces County. COVID cases are increasing per day across the coastal bend area. And it's not just here in the coastal bend. Here's a broader look at South Texas. This is the same type of graph. Now we have Nueces right here, Portland and Aransas. It's not just those cities, but I'm naming the cities that people recognize that are in the counties that are listed here. These are some of the bigger metro areas in South Texas. So San Antonio has the most new cases per day, followed by Brownsville, McAllen, and Laredo. Laredo here. And then Nueces is a distant fourth place from them. So that's good news for us, but the bad news is we're all going up. And so this is what we're talking about with the context of it's not just a localized outbreak, it's everywhere. And it's not just in South Texas, it's over most of Texas in general. So these lines are the same as types of lines and same type of graph as the last one, new cases per day per capita. And what you can see is up in the northeastern corner, Longview is increasing the most steeply, but that could be tied to some correctional facility outbreak numbers. Austin, second. Houston, third, and then we in South Texas are there in fourth. And if you look at that line, you'll notice that we're rising more rapidly. We passed El Paso, Amarillo, San Antonio, and Dallas, and those whole counties in terms of new cases per day per capita in the past week or two. So the cases are rising more rapidly here than in Dallas, a place where there's a much higher density of people. And it's something that we need to pay close attention to. Now, what I will say is that Nueces is not driving that pattern as strongly as other places in the South Texas area or in this southern area like Brownsville, McAllen, and Laredo. But nonetheless, we're rising rapidly. So this is a reason for concern. This is a statewide Texas outbreak. If we look locally back at our proportion of positive tests, it's increasing. You can see right here. And there's been some talking points out there that maybe there's a statistical artifact, there's more testing. Well, we've accounted for that here. We have a rolling average on the number of tests per day. The average over the past couple weeks is about 133 tests per day. And you notice it's not going up or down very much. In the last day or two, maybe that number has changed substantially, but not for what we're looking at here. Over that period of time, we went from somewhere around 2% to 15% positive tests on average. Now, this data that we're dealing with, we don't actually have the sample of people and then which of them were positive. We get the same data you all do, which is on today there were this many tests which were done today, but no positives usually come back from those tests on the same day. And then we get the number of positives which came from tests on another day. So we average this out, and what I would say is that what you can use this for is to compare from time point to time point. The estimates are equally biased, and we're certainly on a huge increasing swing that we haven't seen before. Let's see, this over here, this was the localized outbreaks that we had in the middle of May. So you can see how the scale of what we're looking at now is a lot different. And basically, this was how the inside of a meatpacking plant affected our numbers. And now here's where we're at in the whole coastal bend area. So there's reason to be concerned. Moving forward, so that was case data, and we're plotting lines through points. From this point forward, what we're doing is we're running an epidemiological model or two that simulate the actual pandemic. So it's not just a statistical procedure of taking a line and how does it best fit to the points. We're actually simulating how the pandemic operates, including interventions and estimating transmission rate, people getting infected, people infecting other people. people going to the hospital, and people hopefully getting over here to recovered, and not too many people getting all the way down to the bottom over here. So this is one of the main things that the task force does, and we use this to project forward and project backwards also. So one important number with COVID is how rapidly can it be transmitted. So we call this the transmission rate, and our estimate of the transmission rate without any interventions is around 3. And this is ticking up since a few weeks ago. Now, the actual number, the true number, doesn't change, but our estimate of it changes as we get more information. And so, presumably, as we get more and more information, it should change, our estimate of it should change less and less as we home in on what the actual value is. So what 3 means is that if one person gets COVID, then they're going to transmit it on average to 3 additional people after a week. Those 3 additional people infect an additional 9 people after another week. After 3 weeks, those 9 people infect another 27, and then those 27 infect another 81. So after a month total, with just starting with 1 person infected, you can get up to 121 people infected on average with that high transmission rate. Now, the interventions that are in place, they're designed to reduce this transmission rate. Our estimate of it right now, and depending upon the way these case numbers come out over, say, the next 5 days, this number could increase. But at the least right now, we're estimating it's at 1.6. And what that means is that you go from 1 person to about 17 infected within a 1-month period. Now, here's the thing, that doesn't look nearly as scary as the 3, but it depends on how many people you start with. And the way exponential growth works is eventually, no matter how small this number is, or how much above 1 it is, whether it's 1.1, 1.01, eventually you're going to go into an exponential rise. And the way that this process works is exponential. So if there's a lot of people that have COVID, then you're going to get a lot more people that get infected, even if this number is lower. So it's a combination of how high this number is above 1, as well as how many people have COVID. And we have those 2 things interacting right now to drive the increase in the number of cases that we're seeing. Overall, through time, this is a track record of what we've estimated the actual transmission rate is from the beginning of the pandemic all the way to now. A few times during the stay-at-home, and then after Open Texas began, our estimates went below 1. Those were the times when we were on the backside of a wave and we were going down, right? Remember I said we're on our 3rd wave. When we went down from the 1st wave, that is here. When we went down from our 2nd wave, that's there. We're not sure why we went down after the 2nd wave. One idea is that we saw a seasonal effect that would still be in place right now, but as we slowly turned up that burner and increased risky behavior and group activity around Texas, we eclipsed whatever benefit that we got from that seasonal effect, and right now we're back up at 1.6. Now, I think it's important to emphasize right now is that any good model is not an exact representation of reality. It's the simplest explanation we can make that explains enough of reality to be useful. And so we don't expect that RT is actually changing like this, the transmission rate, but we try to change it as few times as possible while capturing the behavior of how COVID is spreading. And this does a fairly good job of capturing that right now. We use that model to project the number of hospitalizations. And I think it's important to realize that we are not fitting a line to the points. We are making a simulation based upon data that we're gathering. We calibrate it because the one thing is that we don't actually know how many people are infected. All we have is this data on the number of cases or how many people have died from COVID. So what we do is for this model, we calibrate off the number of people that were infected. And once that's set, we let it run, and then it produces this blue line and ribbon, which is a projection of how many people would be in the hospital on any one day. One person could stay in the hospital for multiple days, so one person could be counted multiple times along that blue ribbon. The red points are actual numbers of hospitalizations due to COVID-19, people that are admitted into the hospital. And it's not just, it's the same way. One person could be counted several days. If they stay in the hospital, they'll be counted day after day after day till they're released. So right now, The latest data that I had were a little bit above 20 people that are hospitalized in the Coastal Bend area due to COVID, and it fits the projection pretty well. So it gives us some confidence that the projection and the simulation we're doing right now is well calibrated. The one thing I'll point out is that from here to here, it does seem to be increasing steeper on those red points than the blue line is, but if you look back through time, there's this oscillation that's occurring, and so we might see a drop down in the number of hospitalizations because of that just natural behavior that we're seeing maybe due to days of the week. Now, something you notice is we can't see where it hits the axis over there a month from now, so we got to zoom out. So this is the same graph zoomed out, and we do this just so you can see how well the fit is there, but we zoom out so you can see where we're headed to. And about a month from now, if we stay on the same course, what the model is projecting is that there will be somewhere around 150 people that are hospitalized on July 17th. Now, that's assuming that we don't change our behavior and we don't do anything different now or in the next month than what we've done over the past several weeks since Memorial Day weekend. And hopefully, some of us will be changing that. I want to emphasize that the hospitals have surge plans in place, and Dr. Ram talked about that a little bit. And so you can rest assured that the hospitals have had plenty of time to prepare for this at this point, and they've assured us that they're well ready. But we don't want to let this go so high that the surge planning can't deal with it. And so it's going to be important that we don't stay on this track for too long, because eventually, it doesn't come down unless we change. This is the projected number of people in the ICU. Again, this is COVID-19 patients. Everything I've been showing is COVID-19 patients, not just everybody that are in the hospital or the ICU. The red points, again, are actual numbers of people that are in ICU beds on any given day. A person may come in for an hour and then leave. That counts as one. A person may stay for 3 days. They'll count as one for each of those 3 days. Again, the blue line is the projection from the model. And what you can see is that, again, we're not hitting the axis we're not hitting July 17th yet. So if we zoom out a little bit, we can see that the projection for July 17th is somewhere around 40 people being needing the ICU if we don't change what's happening right now. So again, we have control over this at some level. Our behavior is driving this. The cell phone data shows us that we've been turning up the dial on that burner and it's getting hotter. We also have the ability to turn down the dial on that burner, and it's not just government officials that have that ability, but each of us has that ability also. The more of us that insulate ourselves from COVID and its transmission through wearing of face coverings and through social distancing and self-isolating when you're symptomatic, that'll help to make sure that we change this trend and we turn down that dial. So in summary, there's a Texas-wide outbreak. COVID-19 is expanding very rapidly right now, and the 1.6 transmission rate might be an underestimate. We'll have to see what's happening. The last couple days have been really high numbers. We don't expect to see it go from 30 to 60 to 120 to 240 day after day. That would be too fast for anything that's really been observed around the world. So I kind of, I predicted to some people this morning that there's no way that it'll be above 65 this afternoon with the new cases, and we'll see what happens with that. But it's very unlikely to be higher than that right now. So anyway, I think the key thing to know is this is different than the meatpacking plant outbreak and what we dealt with in May. In May, we knew it was localized. We knew it was getting contained. We knew the contact tracing was working. At least we hoped it was, and we had a reason to believe it was going to work, and we had a reason to believe it was going to come down. Right now, if we don't change, there's no reason to believe that this trend is going to change. There's too many unrelated cases out there right now to contact trace and contain. They're not in one zip code. They're not in one building. So contact tracing can't contain this right now. And essentially all of Texas is flaring up. It's important to realize that hospitals are projected to be affected in the near future. The hospitals are aware They do have surge plans in place, and hopefully we can all modify our behavior and help to flatten this curve again. And that's the mode that we're in. We're trying to flatten the curve because there's no doubt that we're riding up another one. So it's important if you're in a managerial position right now, COVID is out there and it's not that rare anymore. It's getting more and more common. If there's loopholes in your social distancing policy, COVID's going to find it. And it's important to comply. If some people are coming in and they're sick, encourage them to go get tested and to self-isolate. And there shouldn't be any blame here. Any businesses or establishments that comply and help to contain the outbreak, they should be commended for the work that they've done, as well as our frontline workers and the people in the public health sector that are helping to contain this, as well as the workers themselves. I think there's kudos to go around for everybody that's helping to make that happen. And definitely for those who are in charge, it's up to you to help make sure your policies will help to withstand COVID. What can the rest of us do? I know this is kind of like a broken record, so we'll try to mix it up a little bit. You should wear face coverings in public. I read a publication today that said for a healthcare worker, they're 80% less likely to catch a virus if they're wearing a face covering. And they're a trained health worker. For an untrained citizen, they're 47% less likely to contract a virus in general if they wear a face covering. So face coverings work. Social distancing is important. Make sure you stay at least 6 feet apart. And the way this works is the farther apart you are, the less likely you are to contract COVID. 6 feet isn't a magic number. 3 feet isn't a magic number. There's a continual decline in your probability of contracting COVID if you're within a certain distance of them. The farther away you get, the less likely you are to contract it. If you wear a mask, it doesn't make you Superman or Superwoman. It doesn't mean that you can stand as close as you want. It just means that you're even less likely to contract as long as you stay far away. Stay home if you can. Self-isolate if you're symptomatic. Right now, I'm really going to emphasize this. It's not the time to have a party right now in the Coastal Bend area or in Texas in general. And if you can do curbside and takeout, this would be the time to try that. Support testing and contact tracing, and if you want to see any of the task force's dashboards or graphs and presentations, you can find them at tinyurl.com/tamucc-covid. And there's a lot of people that go into the success of this task force and the ability of us to create these products. And I know a lot of us were working long hours this week to make sure that we give you the best information that we could. Thank you.
En resumen, un brote puede ser ubicado en un solo lugar o estar disperso en varios lugares. El COVID-19 puede dispersarse mediante superficies así como el medio ambiente. Las intervenciones no farmacéuticas han ayudado a la disminución de la propagación del virus en la comunidad. En la actualidad ya no existen brotes en un solo lugar o debido a algún evento. El virus se encuentra disperso en la comunidad en todo el estado. De acuerdo a los estudios con celulares mismos que utilizan el posicionador global, la mayoría de la gente está saliendo de sus hogares casi de igual manera que antes de la pandemia. Mucha gente también está viajando. De acuerdo a los celulares, mucha gente está saliendo de lugares que no son indispensables, como los centros comerciales, los bares y los restaurantes. En cuanto a las cifras en el área de la costa, son 420 casos en el condado de Nueces, 62 en San Patricio y 32 en el condado de Bee. En el área de la costa, la cual cuenta con 12 condados, existe un total de 587 casos, 308 recuperaciones, 274 casos activos y 6 fatalidades. La mayoría de los casos positivos se encuentran en el rango de edades entre 20 a 39 años, aunque todas las edades están reportando aumentos. No hay ningún rango de edades que reporta disminución. El porcentaje de casos positivos se encuentra en un promedio de 16% diariamente. El número de personas que una persona positiva puede afectar si no toma precauciones es de 3. A lo largo de un mes serían más de 120. Actualmente, con las intervenciones sugeridas, una persona infectada puede infectar a 1.6 más. En un mes se traduce a 17 personas. El virus continúa propagándose de manera rápida en el sur de Texas. Existen muchos casos que aún no se pueden rastrear y se estima que los hospitales se verán afectados en un futuro próximo. Los hospitales están conscientes a esta situación y toman todas sus precauciones para seguir enfrentando esta alerta de salud. Para contener estos brotes se deben de seguir las recomendaciones y ver en dónde hay problemas para evitar más contagios. La presentación de día de hoy se encuentra en el portal de la ciudad al www.cctexas.com/coronavirus o en el portal de la Universidad de Texas A&M Corpus Christi.
Okay, we're going to field some questions from the Facebook Live broadcast.
Okay, there's the first one. Is there any molecular data on the virus being investigated?
Yes, not in the coastal bend that I know of, but worldwide there's certainly a lot of molecular work that's going on. That work is being used to understand how the spike protein is evolving. Spike protein is what the coronavirus, the spikes, if you remember the image with the little points on it, that's what helps it break into a cell, and a mutation in that spike protein could affect its infectiousness. There's also molecular work on how it's evolving overall, where COVID-19 came from. It's related to a bat coronavirus with a little bit of like 4% pangolin coronavirus mixed into that. And then the last article I read on it indicated that it's naturally evolved through that and then in a human host past that to today. And it seems like it might be further evolving as this pandemic proceeds. I'm sure there's plenty other of ways that molecular work is being done on the SARS-CoV-2 virus.
And this may be a similar question asked differently. Does the source of the current outbreak differ genetically from the virus in March or April?
I have read conflicting reports about that. Certainly, if you look at an evolutionary tree of the virus, and viruses evolve very quickly, you can certainly see that there's different strains out there. Whether some strains are more infectious than others, I've seen conflicting reports where there's some reports where you see an increased or decreased infectiousness, and other reports where they're unable to detect any. So I think that overall we're still trying to figure that out. And by we're, I just mean scientists collectively, not anybody on the task force right now. Although that's the type of scientist I was, and that's what I kind of wish I was doing to look at this pandemic, was analyzing the DNA, but as it is, we're looking at the spread of it. Yeah, sure.
So what was the question, sorry? Oh,
So the question was, does the source of the current outbreak differ genetically from the virus as it did in March or April?
Not that I know of. I haven't read anything about it. Maybe Dr. Bird is aware of some, but I haven't heard anything about it. So far, it's behaving clinically. When I see them in the hospitals, the spectrum is same. We kind of know what the pathophysiology is, what is it affecting, what kind of things we can expect out of this virus, but not much. Maybe the virulence-wise, we just have to see, because we just have only few patients here in our hospitals. So anything we say, we don't have large numbers to say the virulence has increased or decreased significantly. So in other words, what we see right now in the hospitals, exactly the virus, the clinically it's behaving, or we can predict the course of the disease pretty much very well. So does that answer your question?
Again, this is coming from Facebook users, so hopefully.
Okay, sure. Sorry.
Hopefully it does.
Mm-hmm.
And then the next question, I think Annette's going to be able to answer. Do the test numbers reflect tests taken at primary care physicians' offices as well?
Yes, all of the tests that come in, all the positives, they're required to report to the health district by law. They're coming from doctors' offices, hospitals, emergency cares, minor emergency facilities as well. They're coming from private doctors' offices, so they come from all over. As long as they're within Nueces County jurisdiction, they come into the health district.
And that concludes the questions from Facebook.
Thank you.
Thank you.
One thing I for the people out there is that if you want to find the scientific papers, a good place for you to go would be Google Scholar, and you could type in a search just like you do in Google, and you'll find a number of peer-reviewed articles that will address some of your questions, such as the infectiousness of COVID.
Okay, at this time, we're going to show the video that has been pre-recorded by Nueces County Judge Barbara Canales.
Hello, everyone. Barbara Canales, Nueces County Judge. Well, it has been a very busy week here in Nueces County as the COVID-19 pandemic continues. Our number of positive test results has grown dramatically. Our hospitalization patients has grown dramatically, and our number of patients in the intensive care unit has also grown. And in 1 week, the number of deaths due to coronavirus has doubled. This coronavirus continues to spread in Nueces County, and we need to mitigate that spread. There are things we can do as individuals. We can stay at home, social distance, wash our hands, and wear masks. And I'd like to talk to you today about masks and a mask order. Masks slow the spread of the virus. Masks protect both the person wearing them and the people around them. Masks help businesses operate more safely, and when businesses can operate more safely, they can stay open. And I want to keep businesses open and operating safely. The way we can do this is with a mandatory mask order. Governor Abbott has given county judges and city mayors the authority to impose mandatory mask orders on businesses with fines for businesses which do not require or enforce the wearing of masks. And as you've seen in the news, all of the major metropolitan areas in Texas are imposing mandatory mask orders, and they are doing so throughout our region here in South Texas. When this crisis began, I pledged to you all that I would make decisions informed by science and driven by data. I also pledged that I would make sure that our decisions would be right for our local conditions here in Nueces County. And when Governor Abbott said we were going to open Texas, I also pledged that we would be an example for doing things right. In this case, a mask order and doing a mask order right means getting the input of our elected officials, our business community, and our public health experts. Doing a mask order right means that when we put out a mask order, we have the answers to the what about or what if questions. Doing a mask order right means giving businesses the time to get masks for their employees and time to understand the order. And doing a mask order right means we give our citizens the notice needed to understand what a mask order means to them and what it doesn't mean. Today, I'm not able to get a mask order done right. I believe one is needed, and I'd like to get one as soon as possible, but I also think I need to work throughout the weekend to continue to consult with our elected officials, business community, public health experts to create a mask order that is right for Nueces County. And the order will and can come out as soon as we can do that correctly. Until then, I'm going to ask all citizens and businesses to act responsibly and conduct yourself as if we had an order in effect. We want people to be safe, and I know that there are many that do not want to wear a mask, and we know that they can be sometimes uncomfortable and awkward and a nuisance, and with our South Texas heat, sometimes that can create its own problems. Nobody wants to wear face coverings, but nobody wants our economy to close either. And most businesses don't want to impose a mask for their businesses if their competitor down the street doesn't have one and provides an unfair advantage. As the governor said, we don't have to choose between opening up the economy and keeping people safe. We can strike a balance here in Nueces County, and I know we can do it right. So I want to tell you that I will be considering a mask order that's perfect for Nueces County this weekend. And so in the very near future, we can make certain that an order that's driven by science and data and experts can be issued. And it will address the questions that we know people will have. So until then, please, to the greatest extent possible, practice social distancing. Wash your hands and wear a mask where you cannot social distance. We know these are mitigating factors. We know this can help the spread of the virus. Now, shortly, I want to explain to you what has transpired in Nueces County over the past 24 hours. We have issued 3 different press releases. One dealt with county employees. There are 2 county employees that have tested positive for the coronavirus in one department, and there were 3 county employees that were outside of the county courthouse that tested positive also in another department. There was an additional employee, a state employee that does business with the county, and in all cases, direct contacts have been asked to quarantine. They have also been asked to test, and offices have been disinfected, and we have been able to maintain a safe courthouse. In addition, we had a mass testing of county employees today, and we're going to continue that process next week to ensure that the data is always driving the decision as to whether or not we should stay at the courthouse or work remotely. In addition, this afternoon, we were able to ascertain that there was also a positive employee at our Nueces County Appraisal District and also at our Barnes Juvenile Detention Center, our Post-Adjudication Detention Center, and Juvenile Probation Department. Again, in all those instances, we were able to isolate the individuals, quarantine them, get all direct contacts of those individuals isolated and tested as well. We're going to begin the process of disinfecting those other locations, and we are absolutely committed to being as proactive as we can. Also, I'm committed to giving you the information as we receive it in a transparent and open way. I want to thank you for this opportunity to visit with you while I'm at my home and I'm still on quarantine. I will be back next Thursday where we will hold Commissioners Court on Thursday, June 25th at 9 a.m. Thank you, and I'll be available on email or on my cellular for the media to ask questions.
En resumen, el coronavirus continúa propagándose en el condado de Nueces, por lo que continúo pidiéndole que utilice su cubrebocas. La mayoría de los condados de las ciudades en el estado están implementando la utilización del cubrebocas de manera obligatoria. El día de hoy aún no cuento con una orden para la utilización del cubrebocas, pero voy a estar trabajando en la creación de una orden este fin de semana. Le quiero pedir sobre todo a los dueños de negocios que trabajen como si la orden existiera. Igual para los residentes, tome responsabilidad para aminorar la propagación. Mi orden va a estar basada en la ciencia y datos antes de dar esa orden. Por favor, continúe con las otras medidas para mitigar el virus. Un total de 5 empleados del condado han resultado positivos al virus y se han realizado las cuarentenas. Esta tarde también nos enteramos de 2 casos adicionales mismos que hemos podido aislar y hemos llevado a cabo el rastreo. Las instalaciones en donde trabajan también han sido desinfectadas.
Okay, that concludes our prepared remarks for today. Myself, I think Dr. Ramachandran may have left. Is he here still? Annette's still here, our Director of Health, so we can see if there's any questions from the media that y'all might have. Okay.
Here, I just have one for you. With those 19 firefighters that are self-isolating to June 29th,
Yes.
Is there maybe concern or a plan of action of what to do with the department with that many that are out?
Yeah, so the fire chief knows how to handle the situation. So as of now, we need about 94, I think it was the number in the low 90s to run all of our fire companies at all our fire stations. And with overtime, we're able to do that. However, if more firefighters are out for health reasons, whether it's COVID or some other situation, we could be in a situation where we have to close companies. So fire stations would be open, but at one fire station, there could be two companies, two different groups of firefighters that drive in two different fire trucks. So if we don't have enough staff to report to work, the fire station stays open. There'll just be one fire company there instead of two. And so it's a concern, but we're monitoring it closely. We know that the firefighters customarily work overtime, and so that's not an issue. The issue becomes if too many are out, then we'll have to close companies, not stations. But we'll monitor it closely. There could be a situation this weekend, in fact, that might happen on Sunday, and if it does, we'll let folks know. Yeah. Okay, do we have any other questions in the media?
I did have one for Annette.
Sure. Okay, and before she comes down, our numbers are about to be released, so it's the number for today of new cases just from today is almost identical to yesterday. So yesterday we had 65 new cases. Today we're going to report 63 new cases. Momentarily, around 4:35, we'll report that number. So 63 new cases today for Friday. And as I mentioned, we're gonna get the mic wiped down. I'm not gonna come back up after Annette, just so we don't have to keep wiping the mic down. But we will report live tomorrow the number of cases, and live being on our website. And the last couple of weekends we hadn't reported, but we will tomorrow and Sunday as well. And that's it. So with that, let's have this last question for Annette, and then we'll see everybody back here Wednesday. But we will be updating the city's dashboard, city-county dashboard, through the weekend and also Monday, Tuesday, throughout next week. Thank you.
El día de hoy se reportan hasta el momento 63 casos positivos por el virus. Esa es la cifra más reciente con la que contamos el día de hoy. Le queremos recordar que las cifras también se van a reportar este fin de semana en el sitio de internet de la ciudad, que cuenta con toda la información. El portal de internet es www.cctexas.com/coronavirus. El fin de semana se van a reportar todos los casos después de las 4:30 de la tarde.
Yes, ma'am.
I just have specific, I guess, instructions from you that the health department might have for someone that's already been tested and they're waiting results. What is it that they should be doing? Are there going to be consequences if they go out and about knowing that they could possibly be positive?
Well, if they've been tested, that means that they're sick, and so they should be self-isolating, so until they get the results. So that means staying at home, that means not going out in public, that means just waiting, and usually the turnaround time is much quicker than it was a few weeks ago, and so they should just wait till they get those results, try to get well, and as soon as we give the results, then we give more instruction. And it's usually stay at home, self-isolate, and separate yourself from your family members so that they don't get sick as well. You're welcome.